The second case we'll discuss today is from another patient, and Kylene has the details. So what question do you have here?
It's actually more a question of your approach. This patient, a 50-year-old female, presented to us again, chief complaints regarding her heart health. She has hypertension, she's already suffered a stroke, and she's wanting the prevention. She's a bit overweight, constipated, and of course generally unhappy in her condition. So in the beginning, you gave her a heart tonic formula for what you were feeling in the heart, and 5 days later you switched to a completely different approach to a heart clearing. So I was just curious as to what happened, what made you change your direction so quickly, and what is the latest with the patient?
Okay. What can happen is when you're looking at these pulses, especially the heart pulse, which is the left sun, and you run into what's called a scattered pulse. That's when you put your finger on the pulse, and what you notice is that the pulse is not clean. There's not a clean line under your finger. What there is usually several lines all kind of squished together. Because if you roll your finger across the pulse, you will feel all those little lines hitting the pad of your fingertip. That is not normal. You should just have one pulse. It could be a thin pulse or a wide pulse, but there should be one pulse. Now in the case of this patient, when I rolled my finger across that pulse, there's several different pulses. So I knew that she has a little bit of a heart blockage. That's what that means. And this blockage, if you don't feel an extremely thin spike in the middle of that scattered pulse, if you don't feel that, then the blockage is probably in the small vessels of her heart. If you feel a little spike, that's a coronary blockage. Now, this woman had already had a stroke, and if I remember right, does she have some high blood pressure? Yeah, she was on a beta blocker. So when we first got her, we sent her back to her doctor to get her off the beta blocker because she had had the stroke sometime earlier, and these beta blockers are not good. If you can't just live on them. They'll make the heartbeat very slow. The patient will always complain of fatigue, which this patient did, and all the problems associated with bad peripheral circulation based on using a beta blocker, which in this case was metoprolol. So her doctor did take her off the metoprolol, so I was watching her blood pressure very carefully. The first thing I did was I gave her some tonics for her heart, Tianwang Bushindan, and I gave her Zi Gansao Tong, and I gave her Chai Hu Qing Gan Tong because her liver is a little agitated. Now why did I do that? Because her scattered pulse was so weak, I couldn't decide, is it just a heart weakness with a mitral valve prolapse, or is there actually vessel blockage in her heart? She was right on the edge where, is this something that needs to be tonified, or is this something that needs to be vasodilated? I decided on the tonification, and I gave her just a few days of herbs. And when she came back, I looked at that pulse again, and the scattered pulse was worse. So now I know that the blockage in blood flow through her heart is worse than the weak functioning of her heart. So then I switched. And the herbs that I used to vasodilate the large and small vessels going into her heart were Danshen, Maodang Qing, Gualo Shibai Bansha Tong, and a proprietary formula here in the clinic. We call it Stress 1. It's very simple, similar to Circulation Sanjiao, which is sold by Lotus. And it's basically a combination of Zhuifu Zhuyu Tong, Gezhe Zhuyu Tong, Shaofu Zhuyu Tong, and I put in a little Shuizhe leech in there, about 10 grams, 10%. So this formula, this vasodilatory formula, has 4 components: Baodang Qing, 25 grams, this blood mover, this Stress 1 blood mover, 25 grams, Gualo Shibai Bansha Tong, 25 grams, and Dan Shen, 25 grams. And that's what I gave her. And then she came in today, and I said, "How are you doing?" And she said, "Pretty good." I went to my cardiologist, and I said, "Oh, really? Was that a scheduled visit?" "Yes, it was a scheduled visit." And he ran all his typical tests. He did a treadmill on me and everything. And I said, "How are you?" He says, "The best I've ever been. No need to be taking any drugs, and don't come back for a year." So, and her pulse, that scattered pulse, had completely cleared up today. She just had a normal pulse when I felt that heart. It was still a little deep. which means the heart's a little sluggish and there's a little fluid buildup in her chest, in the pericardium, but the whole blockage thing had resolved in literally less than a week using that approach. The cardiologist was extremely happy with her and said, wow, I've never seen anyone improve like this. This is amazing. She didn't say that she was seeing a Chinese doctor because she didn't want to be ridiculed, which is probably wise. So yeah, it works well. You have to determine, because you'll feel these heart pulses. A lot of people have heart issues. I would say the majority of people do. And they either fall into several categories, either blocked blood flow through the heart, or just a weak heart, like a congestive heart problem in embryo, where the pulse will be very deep and kind of empty and sluggish and muddy down there. These people always have too much water retention, especially in their ankles. Or they have the scattered pulse, which is a poor circulation in the heart, or just extremely thin pulse. When you push on it, it simply goes away. That's just your straight up heart chi deficiency, heart blood deficiency. So in practice, you have to look very, very carefully at the heart. The heart is the emperor and needs to be treated, and most people have heart disease. So don't forget that, okay?